Varicocele consists of 40% of all cases of male infertility. Definitely, this is a topic that we should talk about. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about varicocele. Yeah, that is what I am going to talk about. All you need to know. In one of my live videos, somebody pleaded with me. I'm like, Nurse Mercy Mary, I have varicocele. Can you make a video on it telling me all I need to know in regards to the treatment, what causes it, what it really is, so that I stay informed. And I promised this person I was going to make this video. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Let's go straight into the point. So the first one is, what is this varicocele? I don't know if I'm pronouncing it properly, but at least you know what I'm talking about, varicocele. So this varicocele is an enlargement of the vein in the scrotum. Enlargement of a vein in the scrotum. You may want to ask, what is the scrotum and what is the vein? I'm going to be telling you. So for the men, I believe you already have an idea of what scrotum is. The scrotum is a pouch of skin, that pouch of skin that you see behind the penis, where the testes are. That is the scrotum. And also in our biology class, for those that attended biology class in secondary school, they'll tell you that veins take blood away from the body, while artery brings blood to the body in a layman's language. So the veins in the scrotum, when they become enlarged, they will say varicocele has taken place, or this particular man has varicocele. All right? So that varicocele, it's similar to varicose vein. You see, when people have swollen veins, it's obvious in their laps, it's obvious in their body, it's swollen. That is similar to what is happening in the scrotum. Swollen veins. The veins are swollen in the scrotum. So it's similar to what you see in the laps, in the legs, when the veins are swollen. It's just a similar thing. So the second question is varicocele life-threatening? Generally, varicocele is not a life-threatening thing, but it becomes very important. It becomes disturbing when you are trying to give birth. Remember what I said in the beginning, 40% of the cases of infertility are varicocele, right? So it becomes important, it becomes disturbing when you are trying to give birth. The third question about varicocele is, does it affect fertility? Though some medical experts are unable to draw the rope or a thin line between varicocele and infertility, it is believed that when the vein enlarges, it builds up heat. There is heat around the scrotum as a result of that enlarged vein, and that affects the production of sperm. It affects the quality of the sperm. So with that, it might result in infertility issues that is associated with varicocele. So the next question is, what are the symptoms of varicocele? What are the symptoms? How do I know that I have it? So the first one is a dull testicular pain or aching in the scrotum, which usually goes away when you lie down. Then the second one I have to share with you is swelling in the scrotum, when you notice some swelling in the scrotum. Then the third one is trying to get pregnant, trying to make a wife pregnant after 1 year of trying. That is also a sign of varicocele. Then another is shrinkage of the testicles. When the testes, you notice that there's a shrinkage, it's becoming smaller, that is a sign. Then the fourth one is small lump above the affected testicles. You notice that there's small lump above that affected testicles. So these are the signs of varicocele you should take note of. Then that takes us to the causes. What is likely going to cause this varicocele? In terms of the causes, there is no direct cause. We can't pinpoint that this is actually what is causing it. But some medical experts believe that it could be as a result of a faulty switch, that's a valve, that is in some veins in the spermatic cord. For those that don't know what the spermatic cord is, the spermatic cord is what holds the testicles in place. The spermatic cord holds the testicles in place. So they believe that when the switch, the valve is just like should I say open and close, something that opens and close, open and close in the vein, allows blood to go in and out. So when there is a fault in that valve, that is what they are thinking would result in this varicocele. And for those that are asking, who can this varicocele, not cele, who can this varicocele affect? Varicocele can affect any guy, any man of age. As far as you are a man, it can affect you. So it doesn't have, oh, if you are tall, if you are, no. But some experts believe that varicocele actually is actually present at birth, but most teenagers tend to notice it when they are grown up. So it's present at birth, but they notice it when they are grown up. So do you also know that there are different grades of varicocele, and that different grades determines the treatment that should be used for it? In terms of the various grade of varicocele, we have the grade 0, we have the grade 1, we have the grade 2, and we have the grade 3. Let's begin with the smallest type of varicocele, which is the grade 0. For grade 0, the doctors, they cannot feel it. But what happens is that they can be seen in an ultrasound. They cannot feel it, but can be seen in an ultrasound. Then the other one, which is the grade 1. For grade 1, they can feel it when you perform the Valsalva maneuver. For grade 2, they can feel it even if you don't perform the Valsalva maneuver. Then for grade 3, which is the biggest, is the largest, it can be felt and it can be seen. It can be felt and it can be seen. That is the grade 3 varicocele. So then that takes us to the complications that are likely going to arise. So the first one is azoospermia. This is a condition in which a man ejaculates but no sperm to fertilize an egg. Then the second is low testosterone level. And we all know that when there is a low testosterone level, there's going to be low libido, there is going to be a decreased muscle mass, there's going to be a reduced sex drive. So these are the likely complications from varicocele. Then that takes us to the last part, which is the treatment. In terms of the treatment depends on how severe it is. But in general, there is no treatment basically for varicocele. So you can do some home treatment, such as using an ice pack for the pain. You put it on the scrotum when you're having such pains. You take over-the-counter painkillers, such as your paracetamol and ibuprofen, the non-steroidal anti-inflammatory drugs. Then also, you can avoid wearing tight-fitting clothes, because when you wear tight-fitting clothes, it's going to actually, you understand, increase the pain down there. Then when it becomes severe, it requires a surgery. Then varicocelectomy is done to remove the varicocele. So these are the treatments planned for varicocele. Varicocele is not really a problem per se. It's not really life-threatening. It only becomes a problem and makes you disturbed if you are trying to give birth, but it's not coming up. Yeah, that is when it becomes a problem. For the subscriber that asked about varicocele, I hope I'm able to answer this question judiciously for you. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.